Good afternoon, ma'am. I am Mary Jan Valeta Katubig from AMDNA Second Year College, Section G. So today's video demonstration, I'll be performing wound care. So wound care prevents infection and complication. Then it is also help to speed up the healing process, and it also less scary. Then let's start. But first things first, we need to review the medical's order for dressing change procedure. Then after that, it is the time to explain the procedure to the client and instruct the client not to touch the wound area and any sterile supply. But before that, we need to first greet the patient, and then after that, it is the time to explain the procedure. So good afternoon, ma'am. I am your CNA today. I am Mary Jan Valeta Katubig. So for today, ma'am, we would be doing wound care. Okay? Then after that, it is the time to close curtains, window, rooms for privacy. The next, it is the time to position your patient in a comfortable position and drape the patient with this bath blanket exposing only the wound site. Then, after that, place this waste receptacle within reach of working site. Then, after that, it is the time to put on face mask and eyewear if needed. Then, it is the time to wash our hands thoroughly. Then, after that, it is the time to put on clean disposable gloves. Then, remove bandage, dressing, then ties. So, remove tape, pull parallel to skin, pull towards dressing. Then, with this hand glove, carefully remove the gauge dressing, one layer at a time, and taking care not to dislodge any drains and tube. Then, keep this soiled dressing under surface and away from the clients. Then, if the dressing sticks into wet to dry dressing, do not moisten it. Instead, free dressing it, and alert your client in potential discomfort. Then after that, make sure to observe the character and the amount of drainage in dressing and the wound appearance as well. Then it is the time to dispose it in the waste receptacle. Then after that, it is the time to dispose this hand gloves into the waste receptacles. Then after that, it is the time to open sterile dressing tray, or you can also have your individual wrap sterile supplies, and place it on the bedside table, as you can see. Then it is the time to apply the dressing. But there are two types of dressing: the dry dressing and the wet to dry dressing. So let's go first to the dry dressing. So we need to prepare our equipment. we need to obtain the sterility. Then, it is the time to pour bottle of solution into sterile container in the sterile basin. As you can see here. Then, it is the time to apply the sterile gloves. Make sure to touch this side 1 inch to obtain the sterility. It has also 1 inch. Make sure to touch this area only. Then, apply it alright. Then after that, we really need to inspect the appearance, drainage, and integrity of the wound. Then make sure to avoid contact with contaminated material. And it is the time to cleanse the wound with the solution. So, make sure to use a separate swab for each cleansing stroke. We also have this sterile swab. So we just need 4 sterile swab. Make sure to cleanse the wound from least contaminated to most contaminated area. Make sure to use a separate swab for each cleansing stroke. Then, after that, use dry gauge to swab in the same manner as is shown in the step 16A4 to dry the wound. Then, apply antiseptic ointment if ordered, using the same technique as in cleansing. Make sure to use a separate swab for each stroke. Then, after that, it is the time to apply loose woven gauze as a contact layer. Make sure to open it. You can also use your forceps to dip it on the Then after that, it is the time to apply 4x4 flat to fit around the drain, if present. Pre-cut gouge is also available. Then apply the second layer of gouge. And lastly, it is the time to put this thicker woven pad. We also need to tape it. Make sure to tape it carefully. Then after that, position your patient in a comfortable position. It is the time to remove these gloves. And dispose it in the waste receptacle. is the time to position your patient in a comfortable position. Then dispose all your supplies. That's all for the dry dressing. So let's proceed to the wet to dry dressing. So next, let's proceed to wet to dry dressing. So first things first, we need to pour this prescribed solution into sterile basin and add some fine neem gauze. I think one is enough. Then dip it. It is the time to put our sterile gloves. Make sure to touch this 1 inch to obtain the sterility. Then after that, inspect for color of the wound, character of the drainage, type of suture, and the appearance of wound as well. Then next is, it is the time to cleanse our wound with this prescribed antiseptic solution. Then pour it into sterile basin. Again, use separate swab for each stroke. Then cleanse from the less contaminated to most contaminated area. Then after that, it is the time to apply this moist fine neem gauze directly into the wound as a contact layer. We need to squeeze it, then open it. But if the wound is deep, gently pack it into the wound with this forceps until all wound surface is in contact with moist gauze. Then after that, it is that time to apply dry 4x4 gauze over the wet gauze. Then apply this thick woven pad. Then lastly, it is the time to tape it. Then after that, it is the time to remove our face mask and eyewear as well as our sterile gloves by pulling them inside and out. And dispose it in the waste receptacle. Then, assist your patient in a comfortable position. And dispose all your supplies. That would be all. Thank you.